Okay, good morning and welcome to today's presentation, Drug-Free Workplaces, Recognizing the Signs and Symptoms. My name is Kathy Arsenault. I'm the practice consultant for the Association of Brunswick Licensed Practical Nurses, and I'll just be serving as moderator for today's presentation. So of course, as you're all aware, today is International Nurses Day, which coincides with Florence Nightingale's birthday. So once again, ANBLPN would like to just take a moment and wish you all a very happy nursing week. We hope that you've been able to find a little bit of time this week to celebrate yourself and your colleagues and the profession of nursing itself. You guys, as I said, you're the ones that are the backbone of the healthcare system, and you've continued to provide that compassionate, ethical, and competent care despite the massive challenges that COVID has presented to you. So we, of course, cannot thank you enough for that. It is now my pleasure to introduce you to our guest speaker for today, Chantal Cloutier. Chantal is the Regional Addiction Coordinator for the Horizon Health Network, and she is responsible to provide assistance to all employees struggling with problematic substance use. In her role, she provides advocacy services for all employees and their family members, managers, and HRA who are in need of assistance in learning to cope with behaviors and performance issues related to the substance use disorder complexities. A clinical social worker with 30 years experience in the field of addiction, she has been recognized as an expert in the field by the justice system and expert witness. She provides training and expertise to Horizon Health Network, community hospital programs, physician health program, NAV Canada, and community agencies. You are welcome to ask questions throughout the presentation. If you could just type them in the Q&A box, not the chat box, but the Q&A box that you'll see on your screen. And Chantal will answer questions as they're coming in. And of course, we'll provide some time at the end of the presentation as well for you to ask some questions. You do always have the option of sending your question anonymously. If you rather not have your name shown, there's a little tick box that says send anonymously, and so we won't see your name. So thank you, Chantal, for joining us this morning. So on behalf of all of us joining online today, welcome, and we look forward to your presentation today.
Well, thank you so much for the invitation. I'm so excited to be here. And as you will probably notice through the presentation, I'm a bit passionate about this topic, and I find it very difficult sometimes to concentrate on a certain amount of information because I want to share everything that I've learned in this particular position. And as you mentioned, Kathy, I've been in this field for over 30 years, but particularly as the regional addiction coordinator for the past 12 years. And initially, when I started working with healthcare professionals, I was absolutely intimidated by it. And I felt that what can I teach someone in the health profession that they don't already know? But at the end of the day, I found out that this is a disease that does not discriminate. It will affect anyone from any field. And we also now know, and this is an interesting fact, that healthcare professionals are at higher risk than the general population. And the general population suffers from addiction as a prevalence of about 10%, but the healthcare professionals are a little bit higher. It's closer to 15%. So that tells us a few things. And the barriers to treatment, the risky behaviors, the accessibility. So we're hopefully we'll have a chance to look at all of this through the presentation, but please don't hesitate to send your question as we go along. 12 years ago, as I've mentioned, we've initiated this new drug-free workplace program, not knowing what that meant. Horizon is one of the largest employer in New Brunswick, and we have about 13,000 employees, and that means a very large percentage of our healthcare professionals are nurses and LPN, and they are at this point the majority of my clients. I'd like to start by mentioning that going through this presentation, I will talk to you about the process for program, but recognizing that not all LPNs and nurses have access to a drug-free workplace program. But this said, I do hope that you will learn a few things and it will encourage that percentage of people struggling or being at risk to seek assistance through their EFAP program or through a community resource that we'll mention later on. So once an employee has been referred to me, we go through an educational session, an assessment session, and those referrals are usually done through my partners, and most of my partners are, of course, the managers and the union reps, as well as the HR advisors. And once they're referred, sometimes if it's a self-refer, then it's not a mandatory process, but if it's referred by a manager or an HR advisor, then it becomes a mandatory process, meaning that the employee will have to complete successfully the treatment plan that is in place. But the employee is protected under the constitutional and their constitutional rights. And you will hear those 4 words a lot from me within this presentation, and I think it's important that you continue to use those 4 words as guidance in terms of if you are a manager or a coworker wondering about your coworker's health and fitness to be at work. These are the guidelines, and I will repeat them many times during this presentation. There are the performance issues, behaviors issue in the workplace, attendance, and safety concerns. So of course, we have recognized that addiction is a disease. It's a disease of the brain and has been recognized as a disease since 1945. And it is a disease of the brain because of the way it affects the brain. Every time you use a substance, it increases the dopamine level in your brain. More you use, more the brain becomes dependent on the substance to feel normal and to feel the effect of the substance. And it is also a progressing disease, a disease that requires, that will increase tolerance within usage. So more you use at the beginning, more you will need to use to get the same wanted effect. And of course, once an employee is referred, then they are protected under the Canadian Human Rights Act. They are entitled to come back within their own position. Sometimes they will need to have long-term disability or any other benefits that they're entitled to for as long as they require the treatment to be there. So all my statistics I will share with you today are coming from the Canadian Addiction Center, as well as the World Health Organization. So I will mention several different statistics, and please don't hesitate to ask me any questions. So the policy of, in Horizon, we have a drug-free workplace policy where we encourage employees to seek assistance on their own unless they're unable to do this. So therefore, then they will be referred by one of the partners that I've mentioned before. So it is, and what another interesting fact that you might find interesting is that 40% of all long-term disability claims are related to mental health and addiction issues. And why is it so important? Because it's the law. We have the ethical obligation to report ourselves if we are unfit to be at work, but also we have the legal and ethical obligation to report our coworkers that we might be concerned about. And what does that do? Well, it will, of course, increase productivity and increase our clients or our patients' trust. And sometimes that's probably the #1 question I receive. How do I know for sure my coworker is under the influence or is unfit to be at work? Well, if you are feeling unsure or unsafe or can smell a substance or can recognize a change in the behavior, rest assured that our patients are also noticing it. So we need to continue to provide trust to our customers and increase our liability. We want to also make sure that the morale within the workplace continue to increase. And I'll tell you, through their presentation, I will share a few of our stories of clients that I've met. And of course, I changed some of the details about the people that I've seen, so you won't recognize them. But I do remember one situation in a department where everybody kind of knew this coworker was suffering from an addiction. As she was coming and starting her shift, she would often find a little place where she could hide to have a little snooze and lay down, and would probably start her shift an hour or so after she was really scheduled. And some of coworkers felt, you know, she's young, she has young kids, she's a single mother, just let's leave it at that. And other coworkers thought that, well, that's not fair. If she can have a snooze to start her shift, why not me? So it does change the dynamic and create a decreased staff morale within the unit, right? So what's the right thing to do? Should we report this person or not? What should I do about it? What if I make things worse by reporting this employee? But our ultimate goal is to protect our patients and to reduce possible incident in the workplace. We also want to decrease turnovers. As we have found that sometimes people struggling with addiction are seeking employment where there's less supervision, such as night shift, or where they work more by themselves. And then we start noticing change. So the change is something that people who struggle with addiction will go through this long process. They used to be participating in all the activities that was offered within the workplace and having lunch with us, but now they start to isolate, and we see that change. They are more often late than before. They often disappeared early on Fridays, which it starts to be sort of an indicator. And the title of our presentation today is Recognizing Signs and Symptoms. So once you start seeing, as I mentioned, those 4 pillars, performance, behavior, safety, and attendance, there's a change in that pattern. So employees are protected, as I've mentioned, because of the Canadian Human Rights Act. So we do know for sure that we can't discriminate people by their age, sex, or marital status, but it's not as clear because of the stigma attached to this particular diagnosis, that mental health and addiction are also under that same act. We cannot discriminate. It is the same disease. It is seen as a disease as any others, and employees are entitled to get treated without the fear of being reprimanded. So I've already mentioned that it is the law, it is our responsibility, and we have that legal and ethical obligation. Just the same way as if you were hosting this summer, it's a beautiful day this week, we're having many sunny days, and you decide to host a garden party in your backyard, and you invite family members, and one of the members of your family is drinking a bit too much. You now have the legal obligation to ensure safety for that family member. Of course, you don't have to struggle and fight and wrestle with that person if they decide to leave and drive, but you certainly have the legal obligation to do the best you can, to do what you are able to encourage that person not to leave and drive. And if they choose to do that, you also have the obligation to let them know that you will have to call the police if they drive and they're really intoxicated. And why do we have to do this? Because we're working with a large group of co-workers, and our number one priority is to prepare a safety environment for all of us, for all of our co-workers and all our patients. So I'll just start this little commercial for you. The sound is not very good, but there's subtitles, so I hope you can hear enough. So can you still hear me? Am I still on, Kathy?
Yes, you are. Yep.
Okay, good. So I like this particular commercial because it reminds us how we got here, how is it that every day in this country, 500,000 sick days are taken because of an addiction or a mental health issues. 500,000 every day. And we have a tendency to easily blame our physicians, the system, the healthcare departments. But guess what? Our physicians are trained to provide relief, and they want us to be better. And we are very good at complaining to physicians. We want and expect immediate relief for any ill that we have. We don't want to suffer. We don't want to feel any discomfort of any kind. In fact, this country was the happiest in 1950. We were happy right after the war, and we were happy because we've seen how it was difficult during the war. Since then, things have changed. We are very demanding. We are expecting painless in any kind. We want to lose weight without having to do the exercise. We have fast food because we want everything quickly. Listen, we even pay more money to get stuff within Amazon to have it 24 hours before because listen, hey, waiting 24 hours is too painful. So we want immediate relief. When we go to the pharmacy and we see prescription, and you don't have to raise your hands, but the last time you went to get some Tylenol or aspirin, do you have a tendency to pick up the extra strength before you look for the regular ones? Because we want this. We expect immediate relief. We want things to feel better right now. So we are very good also at telling our physician even before we see them what we already Googled. So physicians are in a place often to provide more prescription, more availability without the fear. We're not so concerned about these side effects. If you buy a magazine today, and you will see in that magazine for decorations magazines or a fashion magazine, you will see many ads that offer different types of medication. And I've even noticed on TV lately some ads that promise immediate relief, but they don't even tell you what it's for. They just say, talk to your physician about it. So we are in this new society where we demand and want immediate relief, and there's a medication for it, rather than learning to do it by meditation or by more exercising or eating better. We want the pill that's going to make you feel better immediately, regardless of the possible effects. Side effects are often within those ads, the 3/4 of the risk of the side effects. I like this picture because if I wouldn't have been an addiction counselor, I would probably have been a history teacher, but truthfully, I don't know why those ladies felt they needed that sign. lips that touch liquor shall not touch ours. I think they were pretty safe. But I like also this picture because of the prohibition period when women were not allowed to drink in a public place. Things that certainly changed. And if I was going to ask the group if you thought that the prohibition period worked, most of you would say probably not. But I'll tell you this, the prohibition goal was to reduce crime, to reduce divorce, and to reduce alcohol-related incidents. And it actually did that. Just like we are right now, we are presently in a prohibition period. Maybe some of you did not know this, but if you go to a corner store and try to buy a cigarette, you will see they're hiding behind the gray wall. You will not see those cigarettes. And guess what? Cigarette nicotine is the #1 drug that has successfully reduced in terms of consumers. All the other drugs have increased. In fact, in North America, we're representing 5% of the world population. This 5% is using 80% of all narcotics produced in the world. And this 5% are using 2/3 of all illegal drugs produced in the world. So there is something to say about the desire to be numb, the desire of not to feel anything. And we've learned through the years what those drugs can do. Not too long ago, some of you may already still know some people who have seen that some of the drugs were illegal, and now we think, oh my God, how can that be possible? But cocaine was a legal drug. So this is not what's the correct word? Pick at our new legal drug, which is marijuana. Marijuana is the #1 drug still used in the world, along with alcohol. And both of those legal drugs are causing a huge cost to our society. In fact, it's up to 50 billion per year. But not too long ago, cocaine was in pretty much anything. If you went to the dentist, you were given cocaine. It was even in 1908 in Coca-Cola. So as I mentioned, it's a very expensive business, up to 50 billion within the work in Canada, but within the workplace, it's in Atlantic Canada, it's a 12 billion business. The hidden costs, of course, are included in this. Incident in the workplace, people who aren't able to practice or be fit in the workplace are not as productive. And as I've mentioned, they are accounting for 46% of long-term disability, so they're often absent from the workplace. They often change job, and it changes the way they practice, and it affects the morale. Also, as mentioned, alcohol, marijuana, and narcotics are preference in terms of substance use in the workplace. And I like to remind you that no one is planning to develop an addiction. Addiction is relapsing disease, can be a fatal disease, a progressing disease, and it's a chronic disease and a primary disease. So people can die, and we have lost employees due to this primary disease, which if it's a secondary disease, meaning that you will have complications from that disease, but often the disease itself can be fatal. It will not get better on its own. It will continue to progress, and it will be chronic, meaning it will be for the rest of your life. So when do you know if you're suffering from a substance use disorder? When we call it, it's the 3 C's. The compulsive desire to use knowing in advance the consequences of your usage and the failure to control. You've tried to slow down, you've tried to cut down, but nothing has worked. The diagnosis process is done within an addiction, with an addiction counselor. We have several addiction counselors within our province, but when we do those tests, which are, we have several different types of tests, but within the DSM-5, we measure the tolerance level, the withdrawal symptoms, the intent from the user to have tried to cut down or change their habits, their inability to control that desire, and the behavior that will be done in order to obtain the substance. So often one of my questions to my clients is, what time of the day do you start using, meaning before even you have the substance in your hands? So you need to get the money to buy the substance, to get to the liquor store, to hide it, to stay away from people so they won't recognize it, the change in your behaviors. And of course, it is a recurring problem. So it's on its own, it never goes away. So it needs treatment. It cannot be cured, but treatment is successful if it's combined with all the resources that are available. So we'll talk about this again a bit more so. So one of the quick tests that I suggest, because this is an easy 4-question questionnaire, is CAGE. It's called CAGE. For the first question, have you ever felt you should cut down on your drinking yourself or someone suggested to you? Have people been annoyed by, have people annoyed you by criticizing your drinking? And have you ever felt bad or guilty about your drinking? Have you have an eye opener first thing in the morning and you needed the field to use in order to steady your nerve or to get rid of a hangover? So addiction is a part 2 phenomenon. It's half genetic. We have seen the gene. The gene is called COMT. In the future, I suspect that we will see a test possible to detect if you're high risk to develop the same that disease that you may have in your family. But it's half genetic and half learned behavior. So we've talked about this as being recognized as a disease since 1945 because of the way it affects the brain. It changed the path of your brain. So it requires more substance to start feeling normal. And you need to continue to use in order to avoid the withdrawals effect. Of course, the risk of childhood trauma will increase your risk. Stress in your life or in your ability to deal with stressful events. Cultural influence. Some cultures are more influenced than others. All the nation in the world discovered the process of fermentation, fruit fermentation, where we produce alcohol. All the nation at the same time discovered this process, except one nation. And I suspect you already know who that would be. Native did not discover the same process at the same time and became more at risk for that fact. And we also know if you are suffering from a concurrent disorder, if you are suffering from mental health in addition to an addiction, it decreased by 80% your chance of recovery. Concurrent disorder, meaning some people suffer from an addiction issues and try to self-medicate with the substance. And sometimes the other way around is also true. You have so much anxiety that you use a substance to control your stressors. Did I get that right? So the other way around would be you use so much that you make a mess of your life and you need to self-medicate with a substance. And the other way around is that you're suffering from anxiety and you need a substance to control this. So then you develop concurrent disorder issues, which decrease the success rate. What can also happen is the disease will continue to progress rapidly. The chance to stick to the plan, to the treatment plan decrease. More risky behaviors. If you're suspended from your workplace because you were intoxicated in the workplace, then it changes the way you will need to survive. The risky behavior will need to change. And I'd like to talk to you also about the very first nurse that I've met when I started in this position. Her nickname was Super Nurse. And I always wonder what a super nurse looked like, but she really looked like the super nurse. She was caring, loving, pleasant. Everybody loved her in the workplace. Things started to change for her when her father passed away. Of course, because she was a nurse, everybody expected her to take care of the mom. And of course, because she was a super nurse, she took care of mom and moved her mother in her home. And while her mom needed extreme care, she continued to work and still had 2 kids in university and a husband, and a lot of pressure came upon her. Then when she moved her mom from the bed to the chair, she hurt her back, needed surgery that did not go very well, and started to use her prescription a bit more as a pharmacy. So rapidly, she was running out of her own medication and was started to use her mom's medication for pain as well. And of course, as mentioned, the tolerance level increased rapidly. She started to think that the prescription she had for herself or her mom would not last for the whole month. So she started to dabble in patient's medication. So this incredible amount of medication changed her, made her, it became very obvious that she was unfit to be in the workplace. But remember, this woman's intention was to take care of her family, take care of her mama, and do her best. And it had a direct impact on her ability to work and to continue to focus on her job. So coworkers had the obligation to report her, and she had to go to treatment. But she didn't, it was not, the addiction process was certainly not something she had foreseen for herself. She did not have any background or anyone in her family who's suffering from addiction. You would find also it very interesting that in the methadone programs that we have, which is for narcotic only, for narcotic withdrawals, their clinics are almost at 50% from people who have never used any illegal drugs, who are now addicted to narcotic following a medical issue that became out of control. So within the workplace, of course, this particular employee was reported by her manager. It was reported to the association because she started to have attendance issues. She started to have performance and behavior issues, as well as many safety concerns. And it is the employer's responsibility to maintain a safe and productive environment for all employees. So it doesn't change. Sometimes I've heard managers say, well, it's an added responsibility for me to continue to observe our fitness for our employees, but it's the same for all employees. All employees need to be in the workplace, fit to be at work, regardless if they have a prescription or not. If you have a prescription for any types of disease, but it impacts your ability to be fit at work, you have the obligation to report that possible effect to your manager. So the manager continued to have to treat employees fairly, and never label employees, I think you're suffering from an addiction. But once an employee is deemed unfit to be or impaired to be in the workplace, the manager has the responsibility to send an employee home safely. That means having a family member picking them up or send them by cab. the obligation. So even if an employee says, well, I'm okay, I'll drive home or I'll walk home, we have the responsibility to ensure they get home safely. So they don't have a choice. They do have to get in the cab. We have to provide them with a taxi slip so they can get home safely. We had an employee who decided to walk home and it was minus 25 outside. And of course, that did not go well because when you're under the influence, you don't feel pain. So that employee passed out on the snowbank, so it created a very dangerous situation for everyone. The employer does not have the responsibility to diagnose the addiction issue or to have all the answers about what's going to happen. It's going to be a long process, but need to reassure the employee that once they are fit to have a conversation to reschedule that next appointment, that next discussion. And if the employee refuses to get in the taxi or to get a family member to accompany them home, then you have the obligation to call the police, just like your family member. But not only the employer has this certain obligation, the employee has some responsibility. So if you as an employee are using, you have the obligation to report this to refrain from going to the workplace. So you have the obligation to show fit for work at all time and to decline shifts if it was an unscheduled shift. So if you're home and you're having wine with your spaghetti and you're being called, you have the obligation to decline that shift. You also have the obligation to advise your manager if you are using a medication that might affect your performance while at work. So that means if for the first time you started to use a gravel for whatever reason and you see that it can cause somnolence, well, you have to report that information to your manager. And also you have to report to your manager if you have been charged with driving while impaired and if you're responsible to drive a car. As for example, an extramural employee who need to drive to different patients' home and you no longer hold the license, you have that obligation. So what's the effect of addiction? So all of us are trying to be in the middle between a good day and bad days. We all have good days, we all have bad days. And we are doing everything we can to stay in the middle. Sometimes it's very hard when you have very, very good days. Let's say, for example, you've been to Mexico in the past few weeks. The next few weeks after that may be more challenging. And if you had a few flat tires, it might be challenging. But at the end of the day, we recognize that every day is not a perfect day. When you start using, you have, let's say, for example, cocaine. Immediately, you will feel like you're in Mexico, even better than us. But sadly, like anything that goes up must come down. And that high is not going to last forever. But when you come down, this is the challenge, is that you may feel like worse than your worst day, which is this phenomenon of I want to go back to that great feeling of being powerful, no lack of energy, and feeling like everything is, I'm on top of the world. So you immediately start thinking about that high you had for just before you use. But the process is called the chase. You will never go back to that moment where you felt on top of the world. You will try and try and try again without success. And that's what happened to them. Imagine you have no financial issues. Accessibility is not a problem. You can have any drug that you want whenever you want. And even being on top of the world, being the #1 singer, being the #1 movie star, being loved and cared in every way possible of all the dreams that we had, it's not even enough. Well, simply you overdose. When accessibility is no longer an issue, then why not continue to use? And this is the risk that we have for our healthcare professionals. Nurses, LPN, pharmacists, physicians have access to those powerful drugs. We know they're powerful. We see how powerful they are because we've seen our patients feel better when we give it to them. We have used once or twice and say, hey, that works. That works. But the reason the general population is using is much different than the reason why our healthcare professionals are using. The general population is using to numb themselves, not to feel anything, to disconnect, as opposed to the healthcare professional. When they start to use, they want to increase their performance. They want to increase their energy level. They want to increase their ability to perform, but they also have full access. So I already mentioned most of them. They've seen how it works for patients. They have access, they're exposed, and they may have also this, what I call the white coat syndrome. Kind of gives you a false sense of protection. Well, if I'm at risk, I'll know it, I'll see it, I'll know what to do. And then it becomes a promise that you make to yourself. I'll do it only once, just today, just one last time. But that's the same promise you make yourself every day. And then it becomes an issue of drug diversion. We now have a committee within Horizon that is called Drug Diversion Committee, where we are recognizing that accessibility is a safety concern for the employer and for the employee. And we see it in different tactics, such as wasting dosage, removing drugs from the cart and without having the appropriate signature, hiding different medication by dropping them or by reporting them broken or inappropriate, giving less to a patient that their needs. Duplicating those, removing medication from patients' personal pharmacies as well. And I've, within the clients that I've met who have done drug diversion, they are often very good at identifying a newcomer maybe on the floor, someone that will reluctantly agree not to, or to give the signature when the medication is taken from the cart, and they're too afraid to talk just because they're the newcomer. And even remove medication from the cart from patients who have never requested their narcotics. COVID has changed many things. I don't know. Someday we will know the extent of the impact of COVID on our healthcare professional, but for sure we do know that we have asked healthcare professionals to do more with less. So much new stressors have come in within the workplace, and with less resources, less co-workers, which increase the injuries within the workplace. What's important to also to remember is healthcare professionals are very good at helping others. That's why they've chosen that profession. They are excellent. They thrive on the validation they get from patients, but they also are very good at delaying gratification. They'll wait forever before they get a break. They'll wait forever before they get a well-deserved vacation. but that increased the risk for fatigue and burnout. And it's always a good reminder to say, because you have this in your DNA, very good at taking care of yourself, you always have to remember to put the oxygen mask on your face before you put it on anybody else's face. Because if you pass out, you're not going to be able to assist anybody else. But why do we wait longer to get assistance and support when we recognize that we might be at risk, where the list is very long? Actually, my list is not long enough, but since I only had an hour, I thought I'll start with those few. Of course, we're afraid to lose our license. Other professionals who are not attached to a licensing body, if they need to go to a detox, are not going to be reported to an association. If you have to go to the emergency department, I had an employee who had injecting herself so much that she had endocarditis. And please appreciate that I can't say that word. I practice so much to say endocarditis. She injected herself so much that she became infected. And then where do you go get treatment if you have to go to emergency or your physician without the fear of being reported to your association? And if you are reported to your association, then there might be some consequences which will affect your livelihood directly. And being a caregiver, it's your identity, how you get your gratification. And this is a disease of shame and stigma, and the fear of being judged and discriminated is always on the forefront. So I want to talk to you about enabling, because we care so much about each other. That's the other barrier. Sometimes we're afraid that if I report my coworker, my friend, to my managers, I'm afraid of what's going to happen to her. Will I be responsible for her suspension? Will I be responsible for the change in her livelihood? So sometimes enabling is an act of killing with kindness. Longer we wait before we support someone, longer the recovery process is going to be. Enabling is also believing it's not going to happen on my floor. It's not going to happen around me. I don't want to be involved. I rather look the other way. It's sometimes for a manager is failure to conduct those regular performance appraisal because it's very difficult to talk to them. They're very challenging. There's a bit of resistance, aggressivity. It's refusing to look at the signs and symptoms as a possible issue, hoping that it's going to get better on its own. And what does that mean for me if I start getting involved? Am I going to be part of this investigation? It's believing sometimes the promise of this employee. I'll never do this again. I'm sorry, I've learned my lessons. I promise I'll be better. It's sometimes covering up for them. Well, she didn't have time to finish, so I'll finish her notes, or I'll finish with your last patient today. It's rationalizing. It's telling them that, well, I understand you're going through a difficult time, so I'll help you today. It's avoiding the issue. It's easier than confronting. Blaming the system, blaming everybody else but the person. It's trying to control them. If I have a partner who's struggling, I'm going to hide the alcohol. I'm going to try to control their behavior, their money, so they won't have access to a substance. It's threatening them. But you've said this 25 times, right? I'm going to report you, or I'm going to call your manager, but you never do. You've said it so many times they don't believe you. It's trying to fix the problem for them. I'll help you with this, without, giving them the full consequences. And I have to tell you, in my career, without the feeling of the full consequences, very little chance of recovery is possible. So who is responsible to report? Well, it's everyone. We have the ethical and legal obligation to report. So we have to recognize those signs. We have to be familiar with them. And we'll talk about this in the next few minutes. We need to feel comfortable with this because we want them to have access to the resource as quickly as possible. But you have to be careful because people struggling with addiction are very good at setting traps. They're very good at creating sympathy. If you report me, then I'll lose my job. If you report me, then I'll have to go to treatment, which in itself is not a bad thing. They're very good at finding excuses. It's not my fault, it's my coworker's fault. I did nothing wrong. It's their ability to apologize so profoundly. And sometimes they seem to be so much in pain that we want to believe those apologies. I'll never do it again. It's their ability to change the topic. If you would have given me my vacation when I needed to, then I wouldn't have feel so pressured and I would not be in this position. It's their extreme ability to feel like a victim rather than a participant in this. And of course, when we see anger, our first reaction is to back off. If we have someone who starts screaming and telling us it's our fault, then we will close that conversation maybe faster. It's our ability to feel guilt very quickly. Well, you're right. If I report them, I'm going to feel pretty bad if they lose their job. And we're unable to see crocodile tears. So when we see somebody crying, we want to believe that they are going to understand the seriousness of this issue. Some signs within the workplace are more obvious than others. It's about the change. They used to be participating in every activity we had. They used to have lunch with us, but now we haven't seen them in a long time. They're often hiding or disappearing. They're just not the same they used to be. They have poor attendance, often come in late. They often can't wait to leave on Friday to start their weekends, or often sick on Mondays. You hear more and more complaints from coworkers and patients, a lot more mistakes and missed deadline and shortcuts. They used to do things more thoroughly. Now they can't do it fast enough to get away from their task. They deviate from safety procedure, even though you're asked to put a signature. They often forget. They use the bathroom sometimes to use or sometimes to snooze. And same for their cars. They're hiding in their cars to use or to snooze. Their lunch break is always extended breaks as well. And you try to call them when they're on call and they cannot be found. You want to have that conversation with them, but they're never available for you to have that conversation. If you page them or call them, they're never available. They're hiding from you. And of course, after vacation, you'll see an increase in absenteeism, because often when we're on vacation, we have a tendency to use more. It may take them a little bit more time to recuperate after their vacation and show up sick after their vacation, or not show up at all. Other change is the mood swings. They're more negative. Everything that you suggest always becomes an argument. Very quick to anger. Over criticize. If you criticize them, they overreact and they over criticize everybody else. They seem to be in conflict with everybody in the workplace. They'll just change, and you may even find some of the paraphernalia around them. We know that 1 out of 100 employees are trafficking within our workplace. Some are trafficking different medications, some it's illegal drugs, but that might be another sign to look for. The smell, that's probably the number one question I have from coworkers or managers. They smell like they've been drinking. And once confronted, they may admit that they've been using the night before, but they would deny using that during their shift. Well, if you still smell like alcohol in the workplace the next day, that means your system has not eliminated you unfit to be at work. If any of you smell it, patient can smell it. And it takes, even if you were not drinking in the workplace, which is rare, we rarely have employee drinking in the working hours, but often they have been drinking just before the shift, or they have to use in the middle of the shift any substance. So some of the signs are their eyes are red. They look like they haven't slept for 2 weeks. They have black and blue, puffy, glassy, and their pupil is, depending on the substance, irregular. So if you use stimulant drug like cocaine, for example, well, your pupil will disappear. If you use a narcotic, the pupil dilates and becomes extremely large. And of course, they change in the way they dress, the way they take care of themselves, more bruises on their arms and track marks. So they change the way they dress to hide those track marks. So in the summertime, they wear long sleeves to hide those signs and symptoms. So when we recognize this is an issue and we reported it, then we start talking about the treatment plan. And that's the good news. We have express lanes for some of our employees, and hopefully if you've been able to recognize quickly the issue, we'll try to identify the best treatment plan for that person. Everybody's treatment plan is different, but of course this is where the challenge is going to start. We want the person to recognize they need the help, which increase the motivation and the success rate. But it's not always the case, right? So some employee may disagree, may be in denial, and denial and just a rubber. Some people will say it was just situational. I'm not drinking as much as you think. This is the reason why we need to have an assessment done. And of course, it becomes very challenging for not only for the person going in treatment, but for the manager, the coworkers, as well as the family members. So in terms of treatment, we have 7 detox in this province. And we have 2 rehabs. So the detox is to help detoxify the client. So there's a difference. So those 7 detox will help the client with the symptoms of withdrawals, which last between, depending on the drugs and depending on the amount of drugs being used, the substance being used, the years being abused, but it's usually around 10 days. Give or take a day or so. We have a treatment facility in Miramichi, Tracadie, St. John, Fredericton, Moncton, and Winston, and Hamilton, and rest assured that those facilities are always full. So sometimes it may take a day or so to get a bed, but we always try to do our best to find a spot for an employee who would say, I need to be in detox, and more so for people who are using alcohol. Withdrawals on its own will not kill someone except for alcohol. So this is an assessment that will be done for employees during the assessment process. We also have 3 rehabs. potage, which is for people under 22. We do have employee under 22, but we also have a rehab in Hamilton. And that's 3 to 4 months residential treatment after you detoxified. So you're no longer at risk for withdrawals, which is always full. And we also have a rehab, a 28-day program, which is right now at this particular moment, gender oriented, a 28-day residential program as well. So, any question? I didn't ask that before, but I suspect Kathy would have told me.
Yeah, nothing yet, but I'm sure there's going to be some at the end. This has been really great.
Okay, so I'd like to do, if you're interested, I wanted to do this exercise. It takes a couple minutes, so I don't know if you would be interested to do this, or if maybe we can proceed first with the questions, and see if we have enough time to do the exercise.
Yeah, it's up to you. I'll just have a look here to see if there's anything new. Just people just saying it's been very informative. If anybody has a question right now, I guess feel free to type it in. As I said, you do have the option to send anonymously if you don't want us to see your name. If you use the Q&A box, I'll be the only one that sees the question. So I'll just maybe give you a few seconds to see if anybody wants to post a question to Chantal before she does her final exercise.
So I'll ask you to, because most of you are, I suspect, and if you're not comfortable doing this exercise, that's okay. I'm just going to ask you to take 2 minutes to write down the 10 most important things in your life at the present time. Anything that you find that you need in your life that is essential in your life. So I'll give you 2 minutes to write down those 10 things. It could be anything, your dog, your health. So I'll shut down and I'll give you those 2 minutes to write down those 10 most important things. Kathy, are you still there?
Yes, I am. Yep.
Okay, I was trying to put my camera on and I don't know.
Oh, you just turned it off, actually. You had it on the whole time.
I did?
You did, yes. So now you have it off. So you might as well turn it back on.
Okay, but I can't.
Oh,
It
just
won't
hover.
let me.
Oh, there, we see you. Yeah,
Oh, okay, good.
you're back.
Oh, I thought it was off the whole time. Okay, so everybody's got 10 most important things in their life, right? So I'm gonna ask you, because you all know God was a woman, to recognize that I'm going to be the God today. And because I'm God, I can do what I want. And you don't always need to understand why, because God always has a plan for us. So out of those 10 things, I want you to remove 3. You get to decide and choose. So you should have only 7 left. So everybody's got 7 now. So because we don't trust life, sometimes we want to write our own stories, and we can't see what's coming that might be best for us at the end, so we don't trust it. So, but you're gonna have to trust that God is going to make the best plan for us, or your higher power, whichever it is. And because I am it today, I'm asking you to remove 3 more. Get stuffer, really. So now you only have 4 left. So I'm going to ask you to remove 3 more. Essentially, you're left with what is the most important thing for you. That is the most important of all that you've chosen. Oof, and this is going to be so tough, because I'm going to ask you to take that one off your list. And this is what addiction is. You lose slowly everything that matters to you. So if your health was on the list, well, we all know that addiction creates health issues. If your job was on the list, well, I've seen people lose their job because of addiction. And if your kids were number 1, depending on the day, if your kid was I've seen social services having to remove children from an unhealthy environment. So this is the cost of addiction. It's painful, it's forever, it's chronic, but all of those things that you've lost, you can gain again within recovery. So I hope this was helpful. I hope you've learned a few things. I hope if you have questions that you can feel free to send it my way at any time. And it was a definite pleasure to participate in this very important week